Gum recession. Recession, also called gingival recession, is a progressive disease in which, as it progresses, gums are lost, causing the root of the tooth to become exposed. You may have tooth sensitivity when eating and brushing, pain, or a bad odor from infection. Who can be affected by gum recession? People most at risk of being affected by gum recession are those who have any of the following characteristics: suffer from periodontal disease, have braces or other orthodontic treatment, chew tobacco, have a lip or tongue piercing, brush their teeth aggressively, poor oral hygiene. Seniors. What are the symptoms of gum recession? People with receding gums may experience the following symptoms: bleeding after brushing or flossing, bad breath, sore gum line, visibly receding, sensitivity to heat, cold, or eat something hard, sensitivity during dental hygiene. What are the causes or factors of gum recession? This retraction of the gums can be associated with different factors, such as brushing too hard or too aggressively, accumulation of dental plaque or tartar, periodontal disease, trauma or injury to the gum tissue, abnormal positioning of the teeth, misalignment, smoking or chewing tobacco, lip and tongue piercings, age, oral hygiene, genetic predisposition, diabetes, autoimmune diseases. Hormonal factors. How is gum recession diagnosed? When you attend your regular appointment with your dentist, or when you notice bleeding and inflammation in the gums, consult him. Since it is possible that you are presenting gum recession and have not noticed it, and bone loss is common when it occurs. What toothpaste should I use if I have receding gums? It is important to have a desensitizing toothpaste so that it can help with the symptoms of pain and discomfort presented when the gums recede. How can I prevent gum recession? Brush your teeth well twice a day. Floss once a day. Use an antimicrobial mouthwash twice a day. Follow your dentist's recommendations for dental cleanings. Use a soft bristled toothbrush. Do not smoke or use chewing tobacco. To avoid any situation with your gums, it is best to visit your dentist regularly. Thank you very much for what you have explained. If you have any questions about this or other topics, you can contact us at Channel Island Family Dental, as well as our Facebook page. We look forward to your visit, and we will make a timely diagnosis. Our dentists in Oxnard, St. Paul Adventure, Newbury Park, and Port Hueneme will be able to guide you towards the best treatment to take care of your health and give you back your best smile.